Hello, Medicare Advantage risk adjustment operators, innovators, and learners. Welcome to a new month and therefore a new learning episode with the Hughes Academy Risk Adjustment Made Easy, the Medicare Advantage kind. If today is your first time joining us, we want to say welcome. If you have been studying with us, we also want to say welcome. I am your host tutor, Dr. Prince Bewa. Because we are in a new month, we are starting a new learning episode. However, we'll be picking up from the episode that we learned and studied last month, and we'll be following up into this learning episode. And we are very excited to be learning through the supplemental benefits submission guidelines that CMS informed Medicare Advantage plans earlier this year that CMS was going to start collecting this data. In February 2024, CMS informed Medicare Advantage organizations of their intention to collect supplemental benefits data. And therefore, CMS also provided several resources to help health plans accomplish that. And one of the resources that CMS published is the Medicare Advantage General Supplemental Services Submission Guide. And you can find this on the CSSC operations website with all the information that are necessary for a health plan to submit data to CMS successfully. Last month, we went through several of the supplemental benefits data codes and recategorized them in ways that made it easier to see the broader themes that are seen within the supplemental benefits codes. If you have not watched those videos, I will leave a link in the show notes. And as CMS published the supplemental benefits codes, CMS also published encounter data edits that are applicable in the encounter data processing system that helps cross-check and validate these supplemental benefits data. And therefore, this month, we'll be taking several of these new supplemental benefits data specific edits that CMS published for health plans as they submit data to CMS. The first one that we'll be covering this week is the 19000 invalid supplemental benefits submissions. And if you are new to Encounter Data Edits, I also have a playlist within the Hughes Academy Learning Series that covers EDPS edit in a broad spectrum, which is episode number 6, EDPS Processing Disposition Status. And I'll leave a link into the show notes that you can look at that covers a little deeper overall about Encounter Data Edit. But today, we will be focusing on the new supplemental benefits edit. And the first one that we'll be looking at is edit 19,000. Edit 19000 invalid supplemental benefit submission is applicable to encounter data records. So they do not apply to chart review records. And the record section that this edit is applicable to is service line. So if you have a claim 837, the header and the line, this edit is a line level edit. Moreover, the service types that this edit is applicable to as institutional, professional, and DME. So it applies to all the service types that plans submit to EDPS. And the edit is a reject edit, meaning that once this edit fires, the line is rejected. One may ask, what is the purpose of this edit? Purpose of this edit, according to the supplemental benefits guidelines, is that this edit validate that the supplemental benefit service code submitted on the PWK 06 is a valid code, part of the 2024 supplemental benefit reference code. And the supplemental benefit reference codes are the 90 plus codes that we discussed through them last month. So you can check out those specific codes from our videos that we created from last week. And the edit will post when the service line PWK 01 is IR, the PWK 02 is EM, and the PWK 05 is AC. These are the guidelines that CMS has given health plans to identify that an encounter data record that is being submitted to CMS contains supplemental benefit. So far as a plan has these value sets in the record, then it is telling EDPS that watch out, this record is reporting supplemental benefits. However, if the PWK 06 is not matching the supplemental benefit codes, then as you are submitting, this is a confusion. And therefore, CMS, EDPS cross checks that if a plan submits all these code set values on the encounter data record, then the PWK 06 should have one of the supplemental benefit service codes, because that is the purpose of these value sets for these PWK fields on an A37. And also the service line from date should be from January 1, 2024, because the submission for the supplemental benefit service codes as guided by CMS say starting from 2024, the from date starting in 2024. And therefore, this edit 19000 is cross-checking that if the value for all these PWK fields are what CMS designate for supplemental benefits, then the PWK 06, which is the field to report the specific supplemental benefit service code, should have one of the valid supplemental benefits codes. And that is the edit 19000 in EDPS, which is applicable to supplemental benefits submissions. As I end, I want to encourage you to go to our website, www.thehealsacademy.com/resources. You can download some of the resources I touched on earlier in the video. And also you can check out the CMS CSSC operations website, which has the guidelines that you can download from that website. If you have not subscribed to be on our email list yet, I will encourage you to subscribe so that you do not miss anything. And you get the opportunity to also get our signature gift, From Chaos to Clarity, the essential Medicare Advantage risk adjustment data comparison cheat sheet that compare the data sources that are used for Medicare Advantage risk adjustment for you in a very easy way. I hope this was simple and helpful to you. Please like, subscribe, and share to your colleagues that they may also benefit from this. Otherwise, we will catch you next week as we look into another supplemental benefits submission code edits in EDPS. Thank you for spending the time with me, and bye for now.